Good day. This is an overview of treatment for recidivists. Intervention in reducing recidivism. Recidivism, the involvement of any particular individual whom at least acquired one or more imprisonment record as a consequence from an act which is deemed by the law as crime in the time frame of 3 years from the date the individual was formally released, where the repeated act resulted in the arrest, prosecution, conviction, and being sent back to prison. Reintegration is a part of countering recidivism. Reintegration demands the scope of the legal system to be enlarged so that the future life of the offender in the community is considered in sentencing during the correctional phase. Reintegration concept not only serves the local interest by preventing recidivism, but also the personal life of the offender who benefits from the opportunities of a crime-free life. When a prisoner is released from prison, generally they have different needs requiring help. They need education, employment, drug and alcohol misuse help, mental and physical health, attitudes and self-control help. They also need life skills, housing, financial support, and family networks. Interventions, the action of becoming intentionally involved in a difficult situation in order to improve it or prevent it from getting worse. To intervene is an effort to stop the cycle of reoffending or involving in an act of crime by an ex-con. Rehabilitation programs are part of interventions. Generally, inmates are provided with general academic education and skill development education. Countries have opted for psychological treatment and specific treatments for addiction. Sport and recreation are also provided to keep prisoners physically fit. Parole is another form in intervention. Prisoners are released after serving 1/3 of their sentence in prison on the basis of good conduct. She enjoys full or limited liberty according to the law of his or her country. Halfway house is another form of intervention. Halfway house is a community-based center where offenders can obtain basic necessities like food, clothing, and a shelter. Halfway houses offer vocational guidance and help to find suitable employment. Community correction is another form of intervention. The role here is to form responsible, productive men and women returning to their families and communities. The program includes risk need assessment, individual meeting with case managers, cognitive behavioral treatment, and many more. Community corrections also offer treatment and training programs to parolees and persons under probation. This includes a program called day reporting. This is where parolees meet their caseworker and reports their daily progress. Cognitive behavioral therapy is largely used in intervention programs. Principle is one can be conscious of their own thoughts and behaviors and make positive changes towards them. The methods used are structuring distorted thinking and perceptions, which in turn changes a person's behavior for the better. The focus of the therapy is to improve social skills, means and problem solving, clinical reasoning, moral reasoning, self-control, impulse management, self-efficacy, and cognitive style. The distorted thinking which CBT aims to change are poor problem solving and decision making, ability to consider the effects of a behavior, hampered ability to reason and accept blame for wrongdoings, the inability to manage feelings of anger, the use of force and violence as ways to achieve goals, the tendency to act on impulse, lack of self-control and empathy. Interventions can be enhanced. A necessity of an aftercare program which could address a wide variety of ex-convicts' criminogenic needs. This could in turn reduce the chances of reoffending. Gradual integration. High-risk offenders are not directly exposed to the community. Halfway houses will provide mental care and living guidance before entering the community. Lack of human resource and skill related to intervention may hamper the intervention process. Providing training and motivation will ensure social workers to be more efficient, knowledgeable in daily life. Community involvement is also a big part of intervention. Providing seminars, workshops might change social attitude to better awareness. Thank you for your attention and have a good day.